This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from Neurology India, published in 2026. It's a meta-analysis titled Uniportal Endoscopic versus Microscopic Unilateral Laminectomy for Bilateral Decompression in the Treatment of Lumbar Spinal Stenosis.
This is a timely discussion, Alara. Lumbar spinal stenosis, or LSS, remains one of the most common reasons for spinal surgery in our aging population. While the goal of decompression is universal, the how is where the debate lies. For years, the gold standard has been the microscopic unilateral laminectomy for bilateral decompression, the MULBD. But uniportal endoscopic techniques, or EULBD, have been gaining significant ground.
Exactly, Dr. Aris. The effectiveness of these two approaches has been a subject of ongoing debate in the literature. This meta-analysis aims to provide a clearer picture by pooling the most recent data to compare clinical outcomes and perioperative metrics.
Let's dive into the meat of the paper. When we talk about ULBD, the fundamental advantage is that we're accessing the spinal canal from one side to decompress both the ipsilateral and the contralateral sides while preserving the midline structures like the interspinous ligaments. What did this 2026 meta-analysis find regarding the primary clinical outcomes?
The study looked closely at functional recovery using the Oswestry Disability Index, the ODI, and pain management via the Visual Analog Scale, or VAS, for both back and leg pain. According to the paper, when comparing uniportal endoscopic ULBD to the microscopic approach, the long-term clinical outcomes were largely comparable. Patients in both groups saw significant improvement in their quality of life and pain scores.
That's consistent with what we see in practice. Once the nerves are decompressed, the patient generally does well regardless of the magnification tool used. However, the miniaturization of the approach usually brings differences in the perioperative phase. What did the data say about blood loss and hospital stays?
This is where the uniportal endoscopic approach really shines in this meta-analysis. The researchers found that EULBD was associated with significantly less intraoperative blood loss compared to MULBD. Additionally, the length of hospital stay was shorter for the endoscopic group.
Which makes sense. With the uniportal endoscope, we're often working through an even smaller incision with less muscle stripping than we might do even with a tubular retractor under the microscope. Less tissue trauma generally translates to a faster discharge. But there's usually a trade-off, isn't there? Specifically regarding the clock.
You hit the nail on the head. The meta-analysis noted that the operation time for the uniportal endoscopic group was generally longer than for the microscopic group. The paper suggests this is likely due to the technical complexity of the endoscopic procedure and the steeper learning curve involved in managing the fluid environment and specialized instruments.
That's a crucial point for the residents listening. Microscopic ULBD is a very efficient procedure once you've mastered the over-the-top decompression. The endoscope requires a different set of psychomotor skills. Now, what about the safety profile? In a meta-analysis like this, complications like dural tears or post-operative hematomas are always a major focus.
The paper found no statistically significant difference in the overall complication rates between the two techniques. While some might worry that the limited field of view in endoscopy might lead to more incidental durotomies, the data from this study indicates that in the hands of trained surgeons, EULBD is just as safe as the microscopic approach.
That's a very important takeaway. If the clinical outcomes are the same at the end of the day, but the endoscopic approach offers less blood loss and a quicker trip home, it becomes a very attractive option for the patient. However, the surgeon has to be mindful of that increased operative time and the investment required to reach proficiency.
To summarize for our listeners, the study concludes that both uniportal endoscopic and microscopic ULBD are effective in managing lumbar spinal stenosis. While the endoscopic approach offers advantages in blood loss and recovery time, the microscopic approach remains highly efficient with shorter operative times.
It's about choosing the right tool for the right patient and the right surgeon. If you're a resident, mastering the microscopic ULBD is your foundation. But this 2026 meta-analysis from Neurology India makes a strong case that the uniportal endoscope is no longer just a niche tool. It's a legitimate contender for the standard of care in LSS.
Thank you for joining us on the Neurosurgery Hub podcast. We'll link the study details in the show notes.
Stay sharp, and we'll see you in the OR.